So I saw a patient recently who had really bad constipation, hard stools, straining a lot to have a bowel movement. She has to lean forward or lean back to completely empty her bowels. And in fact, she had to sometimes press around the vagina or around the rectum to completely empty. And she had tried all the things, eating more fiber, drinking more water, doing more exercise. And she still found, that her constipation wasn't getting better. And maybe a woman listening to me who you've experienced one or many of these things, and you may even have started to notice that maybe a bulge or a protrusion vaginally. Well, you may have a rectocele and not know it. And so in this video, we're going to talk about what a rectocele is, how and why it develops, and 3 ways to fix it. Dr. Tugbiyele here, board certified, fellowship trained, top doctor in urogynecology in Atlanta. And I've cared for thousands of women with rectoceles who then also had bothersome constipation. And we're going to talk about 3 ways to fix this and improve your quality of life. So what is a rectocele? So a rectocele is a protrusion of the rectum into the vagina. It causes a pocket in the rectum. And so when women are having a bowel movement, rather than the stool sliding out and having it come out easily through the rectum and the anus, our stool gets trapped in the rectum. And this then is noticed as a bulge in the vagina. And it is something that is very bothersome. It's uncomfortable for a lot of women. A lot of women experience this. It is more common in women who have had vaginal deliveries on children, and women who also at the time of that vaginal delivery perhaps underwent something called an episiotomy. A cut from the rectum into the vagina is performed to allow the baby to come out easily, or more easily I should say, but then that can disrupt the muscles between the rectum and the vagina, and later on can lead to a rectocele. Rectoceles are also more common in women as women get older and in menopause. Again, there's a weakness between the rectum and the vagina, and then that weakness can cause a noticeable bulge in the vagina. So one of the first ways that this can be addressed is with something that I tell my patients: dietary and behavior modification. So what does that mean? Drinking more water, improving your diet, meaning getting more fiber in your diet and limiting things that can cause more constipation, like processed foods, excessive dairy and meat. With regards to behavior modification, that's more like lifestyle changes, especially aerobic exercise. Even brisk walking can be helpful. The best time to have a bowel movement would be after a meal. Something goes into the system and naturally that stimulates the gastrointestinal tract to want to empty. So a lot of women will find that having a bowel movement after their breakfast or even after every meal is quite normal, as long as it's shaped well and it's a good consistency, soft, kind of squeezed on each end, almost like a banana. That's kind of the normal consistency of stool. And if that happens once or twice a day after a meal, that's quite normal. Good bowel habits are also important, not holding it in too long. Of course, everyone waits till an appropriate time, but you don't want to hold it too much that when you finally have a bowel movement, a large amount, and then there's a lot of straining involved because it's harder and it's more difficult to have a comfortable bowel movement. And then lastly, normal positioning. And this actually pertains to women who find themselves more in terms of a shorter height, and depending on the height of the commode, it's very important to have the right positioning with the bowel movement. And you've probably heard of a squatty potty. And what a squatty potty does, it actually elevates the legs. When the legs are elevated, and that creates a great positioning when sitting on a commode that allows for a normal bowel movement. And especially women who are shorter, or if there's a higher commode, it's very important to be in the right position to have a normal, more comfortable bowel movement that limits straining. Another effective option is to be fitted with something called a pessary, especially if there's a rectocele or a bulge in the vagina. A pessary can be helpful. Pessary is a silicone type device that is fitted in the vagina. It's made of silicone. It comes in different shapes and sizes. The most common shape, one that's like a ring, it's like a circular ring. It goes in the vagina. When it's the right size for women, you shouldn't see it or feel it. It shouldn't be too big that it hurts. It should not be too small that it falls out, just the right fit. And so that is fitted in the office. And what it'll do is it'll flatten out the bulge. So it helps to minimize that bulge in the vagina from the rectum, so that when you have a bowel movement, it's much more comfortable. And some women like this option. And this is another effective option for a rectocele. Now, some women may not like the idea of a pessary because it's a device in the vagina that may need to be removed periodically, especially for women who are still sexually active, and then placed back afterwards. Some women may need to learn how to remove it, clean it, and put it back periodically to minimize secretions from it. It can stay in the vagina for up to 4 months at a time, but then there's a bit more homework and maintenance with the pessary. And then that's where the last option is surgery. Now, granted, no one wakes up in the morning and says, "Oh, I want to go see the urogyncologist, and oh, by the way, I also want to have surgery." no woman, says that. But as a board certified urogynecologist over the last 20 years, I do know that women who've tried adjusting their diet, they've tried lifestyle changes, they may have even tried a pessary, and they've done all these things, and still there's still an issue. And if there's a bulge, then that bulge is not going to disappear or go away. And other than waiting for it to get worse, some women would choose surgery to nip it in the bud. Now, this surgery is actually quite effective. It's minimally invasive, it's vaginal, and no sutures or incisions on the abdomen, so hidden in the vagina. It takes no more than an hour, and a lot of times these procedures can be done as an outpatient, and women go home the same day and heal very quickly from it. So it is a very safe and effective solution, surgery, if it comes to that. No other option is helped. And so the point is, and I've shared a lot in this video, the point is that rectoceles are common. They occur more frequently in women who've had children, vaginal deliveries, especially if also it involved maybe an episiotomy or a forceps delivery or vacuum delivery to, easiest vaginal delivery. That can put more pressure and have impacted the muscles around the rectum and the vagina that can then lead to a rectocele in the future or a bulge from the rectum into the vagina. There are a lot of ways to manage it, whether starting with, of course, dietary, lifestyle changes, a pessary, and surgery. Now, it's very important to have this checked out because doing nothing actually can cause this to slowly get worse over time. And having cared for women who have had constipation, maybe have seen a gastroenterologist or seen their primary care doctor, they've tried all the things they can on their own and they're still having an issue, they won't know, and they don't know they have a rectocele until they have an exam by a urogynecologist like myself. So if this video has been helpful for you, please do like and share it with another woman, because a lot of women have issues with constipation, having bowel movements, a rectocele or bulge in the vagina, and they think they're the only ones. They're embarrassed. They don't want to talk about it, but these things are quite common. So you sharing this video will actually help them, and they'll be so grateful for it. And if you are a woman listening to me and you have constipation and you suspect you may actually have a bulge like a rectocele, then I invite you to work with me. If you're looking for a board certified fellowship trained urogynecologist who will listen, do a thorough evaluation, and because of my clinical expertise and surgical experience, I'll help you fix this to help you feel more comfortable, confident, and improve your quality of life. You do not have to live or put up with this. And two ways to reach me is, the first way is through my website. That's www.drtugbiyele.com. Then you don't have to memorize it. The link will be in the description and in my bio. That'll take you to my website where there's an inquiry form where you can fill out, and then my team will help you schedule a consultation with me. Or the other way is directly calling my office number, which is 470-325-1280. Imagine how you feel once, that constipation is better, you feel more comfortable, your confidence is higher, and you're able to do the things you enjoy, your quality of life is better, and that bulge is gone. Imagine how you'd feel when all this happens, and all this is possible for you when you work with me. So I invite you to work with me, and I will see you in the next video.